I'm Deputy Director at HEAL, and I'm pleased to see all of you participating this morning, which shows the great interest in this morning's topic. The majority of people in the European Union live in cities, and the share of urban residents is set to further increase. From the science and from everyone's lived experience, we know that the status of the urban environment, the air that people breathe, the noise that we're exposed to, access to green space, the outside and inside temperature, is a major factor for everyone's health, combined with the question of where people live, in an affluent, middle class, or poorer area. In the past years, the recognition has increased that our health and our well-being is very much connected not only to where we live, but also to the quality of our surroundings, not least because of the COVID-19 pandemic, during which people found a new appreciation of nature and green spaces. And many cities have taken action to increase the quality of life for people in cities, to move away from a car-dominated urban environment with, for example, prioritizing walking and cycling. At the same time, city decision makers also need to take action in view of the challenges faced with the climate crisis, trapping heat in cities with few places to cool off, or persistent air pollution, which is a particular risk for children, respiratory patients, and the elderly in cities. In HEAL's work, we often receive the feedback from city decision makers that when considering and deciding on different policy options, what they're lacking is tangible evidence for the city level on both the health impacts from environmental climate threats and also the benefits to health for city residents from measures in this area. As what is more readily available is a health impact and benefits assessment at EU or national level, but seldom broken down to the urban level. With today's webinar, we want to respond to this policy need by showcasing evidence on how people's health in cities is affected by environmental climate threats and the benefits of action, by presenting to you the EU-financed UBDPolicy research project and the wealth of evidence available and the wealth that will be for evidence that will be further generated, and by highlighting selected policy frameworks and networks for cities as part of thinking how we can move from the science to action. And I'm pleased that we have 4 distinguished speakers this morning with us who will shed light on these questions. But we also very much want to hear from you, dear participants. And this is very much an opportunity for you to take part in our exchange this morning. So I will now quickly present our housekeeping rules. And the possibility for you to engage this morning, to ask your questions and share your comments is via the Q&A function, which you find at the bottom of your screen. This is where you can leave us your questions. You can leave the questions type your questions in English, in Polish, or in German, as we have translation available here this morning. So indeed, there is simultaneous translation provided into Polish and into German. And in order to listen to this translation, please go to the bottom of your screen and click on the respective interpretation icon. There will be a discussion following the presentations. And if you have any technical problems, please contact my colleagues Elke or Jacek for support. You can find them in the panelists list. And this webinar will be recorded and published afterwards on YouTube. And with that, I would now like to start the exchange this morning and kick off with the presentations, and would first like to welcome with Professor Mark Nieuwenhuizen from the Barcelona Institute for Global Health, ISGlobal. Mark is the Director for Air Pollution and Urban Environment and Director for Urban Planning, Environment and Health. And he leads the EU-financed research project, Urban Burden of Disease Estimation for Policymaking, UBDPolicy, which you'll now present upon. The floor is yours, Mark.
Many thanks, Anne, and happy World Cities Day to all of you. It's wonderful that we celebrate our cities, because I believe that cities are one of the greatest achievements of humanity. Imagine, so many of us living together now, and what all the activities that are taking place in our cities is great for our living. Unfortunately, there are a few drawbacks of living in cities, and so we still need to improve our cities. And here at ISGlobal, we've been working on this partly as a result of the EU funding for the UBDPolicy project, but I would like to explain a little bit about it. Over the last few years, we've been working with a database of 1,000 cities in Europe, and we've been conducting health impact assessments. These were for the year 2015, but give some insight of some of the challenges that we actually face. So as part of the project, we looked at the exposure levels to air pollution in the cities and estimated the burden related, the mortality burden related to the air pollution levels. And we see that there's a huge burden as a result of air pollution in our cities, and that we could prevent more than 160,000 deaths each year if we would lower our air pollution levels to the new WHO guidelines for air quality. We also know that in many cities, people don't have a sufficient access to green space. We estimated that 60% of people didn't have access to green space as what the WHO recommends at the moment, that everyone lives within 300 meters of a green space of at least 1 hectare. And we estimated that we could prevent 43,000 deaths each year if we would have more green space access in our cities, in these 1,000 cities. Also, noise is still a big problem in cities, and we estimate that 60 million people are exposed to noise levels that are harmful to health in these European cities, and that more than 3,000 people die each year, for example, because of ischemic heart disease that results from air pollution, from noise pollution exposure. We look specifically in one city where we're based in Barcelona. We estimated that we could prevent almost 3,000 premature deaths each year if we would improve urban and transport planning, because the current urban and transport planning leads to very high air pollution levels, noise levels, urban heat island effects, lack of green space, and also lack of physical activity. If we would improve on these factors, we could prevent premature death and also much disease. And we could prevent about 20% of mortality that's ongoing every year here in the city. As Anne said, one of the big problems is that our cities are too car dominated. They take up a lot of space that actually could be used in a much better way that promotes health rather than that's detrimental to health. So to address some of these issues, to come up with more updated estimates of the burden of disease related to current practices in cities, practice of urban transport planning, and also to look at potential healthy scenarios. We put a consortium together funded by the EU to look at the specific issues. The consortium consists of 6 partners from different countries, which you actually can see here, led by us ourselves, ISGlobal in Barcelona. We started earlier this year, and the project is for 4 years. The kind of framework that we're working under at the moment is a very simple framework explaining that the current urban design, so how we design cities, determines how people get around cities, leads to environmental exposures to certain lifestyle factors, and affects our health, and also may lead to premature mortality. For example, I mean, if you design a city for a lot of cars, you have a lot of road space for cars, you get a lot of people using the car, what leads to air pollution, noise, heat island effects, stress, less social contacts, and less physical activity, what leads to disease and premature mortality. On the other side, if you put in, for example, more infrastructure for active transportation, like cycling lanes, you get more people to cycle. That causes less air pollution, less noise, less urban heat island effects, less stress, more social contacts, and more physical activity, what prevents disease and premature mortality. So the overall aim of the project is to estimate, to get a better estimation of health and well-being and social economic cost within our cities in Europe, advance the methodology and produce new estimates. And also a very important part is to strengthen the evidence base for policy making and improve the science policy link. The work is divided into different work packages, which you can see here. Work package 1 deals with an overall framework for health impact assessment and includes reviews. Work package 2 evaluates health and well-being indicators, particularly looking at new indicators. Work package 3 looks at cost-benefit analysis. Work package 4 produces estimates of air pollution, green space, noise, etc. for cities. And then we do a burden of disease estimate in the 1,000 cities. And we do some further work looking at healthy urban and transport planning scenarios in a few case city studies, which you will hear about later on. Then, of course, we have a work package on consultation and also translation. And we have quite a few workshops throughout the project, bringing in experts, stakeholders in all the work what we're actually doing. So here is what you can see, which the cities are, the database. They're spread around Europe. The bigger dots are cities with a higher population, smaller dots, smaller population. What we're hoping to do is produce new burden of disease estimates or mortality estimates, I have to say, to be better for 2018, 21, 24, so we can look at trends. And then also we look at specific cities such as Barcelona, Brussels, Utrecht, Sofia, Warsaw, Manchester, Munich, Zagreb, Basel, to certain policies at specific urban and transport planning policies and see how these can be improved. We use a multi-sectorial, systemic approach for this, and we work with many stakeholders in the city, or hoping to work with many stakeholders. And we hope to get many people interested in participating in the study and contributing. These are from different sectors, including urban planning, transport planning, but of course also, for example, the education sector. Because particular children are affected by current practices in our cities. So what's new in this project? We update the framework for health impact assessment modeling and also produce new models. We come up with new exposure response functions. We're looking particular at new outcomes, in particular well-being outcomes. We produce new urban and transport scenarios for the cities. We'll also provide new estimates for the exposure, for example, to air pollution, noise, green space, heat. Also, we track the cities over time, and we conduct cost-benefit analysis. We're very much working on getting more stakeholder engagement and improving the science policy link, because we know a lot about what makes cities healthier, but we also need to get it to decision and policy makers to actually make it happen. Here a quick example from my own city. This is Barcelona. At the moment we have the Superblocks program, or the green axis as it's at the moment implemented, where you can see how the city undergoes a transformation. What you can see on the left top is what was a street Roquefort before. They actually implemented some interventions to reduce car use in the street and make it more open for active transportation, like for walking and cycling, which you can see on the right side and the bottom pictures. So they transformed an environment that is actually detrimental to health to something what is actually very beneficial for health, because there is more physical activity, there's more green space, less air pollution, less noise. We also conducted a health impact assessment to see if we would implement this kind of model, these superblock models, in throughout the whole city. And we estimated that we could prevent quite a bit of mental health problems. So we could reduce the perception of poor mental health by about 14%, what are around 30,000 people. We also could reduce the use of medication like tranquilizers, antidepressants, and also the visits to mental health specialists, psychologists, and psychiatrists considerably, varying between 8 and 13%. So you see really benefits of changing the urban environment by introducing this new urban model. If you want to know more, we have a website where you can follow us, ubdpolicy.eu. We provide lots of information about our activities, also workshops. And also we have a ranking website called ISGlobalranking.org, where you can see for the 1,000 cities, what are the current air pollution levels, green space, noise, etc., and the related health burden for this. Thank you so much. I'm happy to take questions, or you are also welcome to email me and also get in contact, of course, with other consortium members. Thank you.
Thank you very much, Mark, for this presentation, for this overview, and in a nutshell, what the UBDPolicy project is about, and also for highlighting the evidence that is already available, and that I think it's always so powerful to see these numbers on the clear, on the clear health benefits that we would see from, from increasing green space, or from taking other measures. There are no questions yet. I'd like to encourage all of you participating, to please ask your questions. Don't be shy. There are no stupid questions. This webinar this morning is really about that we can answer your questions. Yes, and now we're moving on to the next presentation as you're still thinking and processing. As you know, the webinar this morning is entitled "From Science to Policy Action," and so we very much want to see which relevant policy frameworks or initiative exist, or a selected one, and where this evidence, the health evidence on the health benefits, could be integrated into or used for. So I'm very pleased to welcome Mr. Harry Tynder this morning. He is the Legal and Policy Officer at the EU Commission, Directorate General of Research and Innovation. And Harry is part of the Secretariat of Climate Neutral and Smart Cities Mission. And you will now tell us about the mission and about the possible links to health. Thank you very much for joining, and the floor is yours.
Thank you. Good morning to you all. I'm happy to present the EU mission, Climate Neutral Smart Cities. It's one of the 4 Green Deal missions we have under Horizon Europe, and it's a new instrument which is basically for us also something which we learn about by doing, actually. So what is this mission about? Please, next slide for this. It is to deliver at least 100 climate neutral smart cities by 2030, and to ensure that those cities can act as experimentation innovation hubs for all the other cities for the achievement of the Green Deal, which is Europe to become climate neutral by 2050. We started this mission in 2021. We started with an expression of interest, which we asked 4 cities whether they would like to join. And I will come in a few slides later back about what the reactions were from the cities on this. The reason why we are aiming for these cities was, as was explained also by the previous speakers, obviously 70% of the European population will be in cities, so they are really affected by what is happening with respect to the Green Deal there. So what do we put in place for this mission? Next slide, please. We have actually 3 components there. The most innovative part is that we ask cities who want to join the mission to sign up for something which we call a climate city contract. And in that, they have to commit to this to become climate neutral by 2030. This is at the level of the mayor of a city. But they have also to make something which is called the Climate Action Program. So how do they achieve this climate neutrality? And it's linked also to what kind of investment plan they would use for that. Meaning that we are going for a systemic approach, as was also in previous speaker was speaking about. We would want to have the city laying out all the aspects which are related to becoming climate neutral, taking into account what their local situation is. So it is a bottom-up approach, and it's not something which traditionally would be done by the Commission, which is top-down, where we tell them how to do things. For this, we have put into place, on the left side of the slide, you see this, the mission platform, which is a consortium of 32 organizations, which are actually going to help cities to prepare for their climate city contract, and then afterwards also to help to how to implement what they are going to do there. They give really tailor-made technical, regulatory, and financial advice for the investment plans, which is one big challenge for most of the cities there. But also at the same time, as we are a Horizon Europe program, we are doing research and innovation demonstrators under the cities consortium, the platform. There are also pilots being launched. We have 52 already of them. And because we would want to reach out also for cities who are not part or not having been selected for the mission, twinning and mutual learning exercise. We have established a portfolio of research and innovation projects, which can be found also in the mission platform portal, where we actually direct cities to results which have been achieved by Horizon 2020, but also by other research projects there. So when a city has prepared its climate city contract, we are reviewing it, we meaning the Commission there, together with the European Investment Bank and the GRC. And when these contracts are at a certain level of quality, we award them a mission label, which we hope will help cities to get access to other funding programs and also help access to funding by private organizations and other funds there. So next slide, please. So who are the cities we have selected? You will see on this slide, I hope it's visible for you there. We have 100 cities from the member states, and we have also 12 cities from associated countries. What you can see here is that it's really a very inclusive list. We didn't take just frontrunners. We wanted to have an inclusive list, having all the member states being represented, but also cities with very different challenges and also different attention already to climate neutrality. Some are frontrunners, some are what we would call followers or beginners even there. So these cities were selected and have started to prepare their climate city contracts. We have had a first wave of contracts which have been submitted to the Commission, and we have awarded now 10 cities mission labels. And we are now reviewing another 27 submissions, and we will see for the end of the year whether they will get the label as well. Next slide, please. I missed one slide, sorry. One of the one of the points, obviously, which is of relevance for this morning's webinar is what is the health dimension which we have here? And actually, the problem which cities are facing is that very often transition is seen as a pure economic challenge there. So, and we have seen that also in the climate city contracts which have been submitted until now, that we are actually, the cities are pretty weak in saying what are the benefits. And I think also there that the health dimension is very important as a co-benefit of going for climate transition. And obviously this touches upon also the just transition, which we will have to apply there, that we cannot support cities' policies which would actually lead to exclusion of citizens to access to services, which would actually lead to districts which are not really having the quality of life which they are supposed to have there. The health dimension can play an important role there. Also, as you have seen from the previous presentation, they could provide arguments and help cities, the city administrations, to basically speak also with their citizens why this kind of transition would also be of their interest. And I think that is something which we see here at the Commission side as something much more important coming up after the climate city contracts have been submitted, basically to make this transition sustainable. And I think there the health part is will be very important. I thank you for your attention. Happy to answer any questions you may have.
Thank you very much, Harry, for this overview on the mission. And indeed, apologies, somehow the slide, I know you had prepared something on zero pollution that was missing. So thank you for filling in on that. I would have a follow-up question right away to what you asked, since you spoke about the climate city contract, and you highlighted yourself that cities, needed to, or it was a wish that cities become stronger in highlighting the health benefits. When the Commission, when you verify the contracts or go through the contract in the draft form, is this something you specifically check for, the health dimension, both when it comes to the impacts, but also when it then comes to cities having to highlight the health benefits?
Yes, it's well, we would call it co-benefits. And one of the parts is health. The other part is obviously also quality of life in general. And we are basically trying to say to cities where we see this is not well developed, that they should do this in the next iteration. The climate city contract is something which is iterative. You don't have a plan from day one about how to become climate neutral by 2030. You will have to develop this. And I think there it comes up as well that they could actually use input from specialists there to make their point about that their policies make sense also for their citizens.
Thank you very much. I definitely see opportunities for synergies here and for sharing and learning. Yes, we have another question. Mark, I'll come back to that question as part of the panel discussion, as I'd now like to move us on to our next presenter and give a warm welcome to Miriam Weber for being with us here this morning and to highlight again the synergies or linkages we could see from this focus on health and the evidence generated under UBDPolicy. Miriam Weber is a policy advisor on healthy urban living, environment and public health at the city of Utrecht in the Netherlands. But Miriam, you're also the advisory board member of the WHO Healthy Cities Network, and you will now present the network to us and then also focus specifically on inequalities. The floor is yours.
Thank you, Anne, and good morning to all. Happy to have you all online, and always a pleasure to share the stories about the healthy cities. So I'll move to the presenter mode. Yes, there it is. So I wanted to share a little bit of background of the healthy cities and some examples from healthy cities and Utrecht, where we are talking about policy and science and the challenges that we have been hearing about during the first half of an hour of this webinar. So what is the Healthy Cities Network? Or what is the European Healthy Cities Network, I should say? This is a network that this year is celebrating its 35th anniversary. That started as a kind of a movement by the end of the 1980s when WHO adopted its Ottawa Charter on Health Promotion. And this was a moment where health was not only about disease, but it was about health prevention and promotion particularly. And their cities came to the table as they became more and more important as organizations at the geographical level that is coping with all these topics on a daily basis. So in 1988, there was the first Healthy City Network meeting in Liverpool in UK. And as I said, this year we are celebrating our 35th anniversary in just 3 weeks, which will be in Utrecht. So the Healthy Cities Network today, we are working in phases, like we call it. So you decide to become a member for a specific phase of around 6 to 7 years. Today we are in phase 7, and it is really about knowledge and experience and innovation. And the key topics we identified for this phase are the so-called 6 Ps, about peace, prosperity, participation, people, place, and planet. And this is all around and all contributing to the health and the well-being of our inhabitants. Talking about inhabitants, we are addressing more than 150 million people, as the Healthy Cities Network comprises all around 1,300 cities in national networks in more than 20 countries. So for example, in France, in Germany, in UK, in Turkey, in Israel, we have so-called national networks of healthy cities. In addition to that, we have around 90 cities like Utrecht that are a so-called flagship city. So cities that have committed themselves and gone through the whole process of accreditation or designation to become a flagship city under the WHO Healthy Cities Network. We have a particular approach, which means that we have political commitment. So either the mayor or vice mayor is dedicated and committed to the Healthy Cities Network. We have technical excellence, so feeding in a lot of newest insights and knowledge, both from academia and from the WHO and from the local level, so from us as municipalities. And a third topic, which is really understanding and our citizens and involving our residents in decision-making processes, in implementation of our work. Looking to our priorities that you will probably all recognize for this phase, it's about healthy urban environments. It's about healthy aging, health equity, and child and adolescent health. A lot of topics that we are familiar with, a lot of topics that we know that are as key priorities at a local level, a national level, and international level. So healthy cities, it's why it all comes together. We call it in Utrecht, healthy urban living for everyone. We want to be a city where people within 10 minutes walking or biking or using public transportation can reach green nature, their work, have access to energy, can find places in times of heat stress, where they have their house, where they have their health services and everything in their neighborhood. So healthy cities is indeed where health is on all policy domains. It's about climate change. It's about climate resilience. It's about access to green spaces. It's about making a city child and age friendly, and it's about healthy urban development. But healthy cities is all where all come together. It's about partnerships and participation, which is really key. And we do that not only in policy making and in implementation, but it's even in involving private sectors, in citizens, other governments like the regional or the national or the international government in what we call quadruple helix collaborations. And what we see today is that we are making a shift from health in all policies to health equity in policies. We want to be cities where we are addressing health inequalities, where we want to provide ample opportunities for all, and where we invest a little bit more where that is needed, because we see that people are lacking behind, or where we see the health and other inequalities. In Utrecht, we started this shift on health inequalities and addressing health equity quite some years ago. And on the basis were this kind of pictures, where you can see the various neighborhoods in Utrecht, and on the left side, the life expectancy and good perceived health. And there you can see that we see quite some differences, although we are a relatively affluent and high educated city. But there are neighborhoods where life expectancy in good perceived health is 12 years shorter than, for example, in the center neighborhoods. And what we see as well is that these neighborhoods and these figures are overlapping when we are taking into account other indicators. For example, how people perceive their neighborhood, or how income is, or how education levels are. So that was the reason that we were starting to take into account inequalities and the perspective of equity in all our other policies. So our public health policy plan is based on an Utrecht health model, we call it, where we say health is the outcome in the end that we would like to achieve. Our ambition is that by 2040, we have 30% less health inequalities compared to 2012. And in order to achieve that, we need to address the personal factors, the living conditions, the socioeconomic position, as well as the socioeconomic and the political context. So our public health policy plan is not only the plan of the public health department where I am working in, but it's a plan for the whole organization. So for my colleagues from the green planning, from infrastructure planning, from the education department, they all are contributing to and are implementing this public health policy plan. In order to achieve our ambitions and in order to address inequalities in its broadest sense, we are always looking forward for collaboration with research projects like the UBDPolicy project. And we is not only the city of Utrecht, but this is the Healthy Cities Network as such as well. And then looking into what we are particularly looking for in this kind of collaborations is deliverables such as policy briefs. What is in a 2-page document? What are the key arguments, the best buys, the best practices that I can hand to my vice mayor or to my manager saying, okay, this is where we should work on. This is where science and science at a local level says that we should go to. We need narratives in order to make and set the agenda. We need infographics and really hands-on tools that are tailor-made for the local level. It was already mentioned by Anne as well. We need evidence-based specifically for local decision making. A lot is presented and researched at a more national or international level or translated into guidance at an international level. But we need it at a really local level. And we are looking for best practices that are transferable between cities and that are implementable and upscalable within our cities or within neighborhoods. And in order to do so and to get these benefits and these deliverables tailor-made for our needs, is that we are looking to co-creation, involvement from the start of a project, being a member, being a partner in projects like UBDPolicy, which allows us to give a voice already at the beginning of a project. This is what we are looking for. Please, science, help us and co-create and work with this on this in our communities, in our cities. And then finally, before finishing my contribution, what we are always looking to is an answer to where to invest in order to reduce health inequalities. If we can spend 1,000 euros, where to invest the 1,000 euros in order to contribute to these challenges we see at a local level in addressing climate adaptation, health inequalities and other inequalities. So thank you for your attention. And in case you have any questions, please feel free to reach out to me after the presentation when we have the discussion moment, or just send me an email.
Thank you very much, Miriam. Indeed, we'll have a discussion and further exchange towards the end after our last presentation. And thank you very much for highlighting both the important work of the WHO Healthy Cities Network, but especially the focus on inequalities. As you could say, this adds another layer of complexity, for the health of people in urban residents. But its focus on inequalities is something that we in HEAL have found is very much an emerging topic. Also for the EU level, for example, we see it currently in the deliberations on the revision of the Ambient Air Quality Directive. So when, how to achieve a clean air, that this is very much a concern and a focus, and rightly so. So thank you for highlighting how Utrecht, the city of Utrecht, is taking this forward. Okay, we have some more questions coming in. I'd like to keep them for our discussion at the end and move us to our last speaker, last but not least, and give a warm welcome to my colleague, Vlatka Matkovic. She is a HEAL Senior Science Policy Officer, and she will now tell you and give you some details on the case studies that are being pursued as part of the UBDPolicy project. Mark already started to mention them, and we now want to give you a deep dive as we think this is particularly relevant for cities decision makers. Over to you, Vlatka.
Thank you very much, Anne, and giving me the last word after this really inspiring big networks of healthy cities and climate neutral cities. I hope my presentation can go in a full screen mode. So I will showcase our UBD, or this stands for Urban Burden of Disease policy project, and it will be a hands-on policy engagement and how are we bringing bridging the gap. So gaps from science to European and city policy. As Mark already mentioned, our project is focusing on air pollution, noise, heat, lack of green spaces for nearly 1,000 cities in Europe, and specific urban and transport policy planning scenarios will be developed for a number of specific cities, so case study cities where we will go into depth. And those cities are Barcelona, Basel, Brussels, Manchester, as you can see, Munich, Sofia, Utrecht, Warsaw, and Zagreb. It might happen that we include a few more if there will be interest and we have capacity. So in those cities, we will go into the depth of policy analysis and also include some other aspects that might be a bit more difficult to model, like mobility or physical activity, and as well inequalities that Miriam already mentioned for Utrecht. Let me change another slide. So to achieve greater science to policy impact and strengthen this evidence-based policy making, we will engage with various policy makers at EU level, like this group here, but also city level. This is very important for us. And we will try with the city level policymakers.
Sorry, Vlatka, I think we have a connection problem with you. I think it's better if you turn off your video because you were cut off there a second. Thanks.
Sorry, is it better now?
Yes.
Okay, sorry about that. So we will engage, as I mentioned, with the EU policy level decision makers and as well cities. So cities is really something we will be focusing on. And I'm trying to move my screen. Oh, okay, it's going. Okay. So cities, policies and strategies, action plans are our project focus. So to build health arguments for policy scenarios, either existing ones or those that would be healthy scenarios. We want to provide city policymakers with really tangible health impact assessment of various policies that they are building on or are implementing. So here you have a example of different kind of policies that exist for various cities, our case study cities. So these are varying from sustainable urban mobility plans in most of the cities, low emission zones, air quality plans. Some cities have strategies for green spaces or public spaces, and only one has a regulation on the noise, which we also want to explore. And how are we building this information for policy scenarios is through 3 basic steps. One is assessing baseline, so the burden of disease in this context of urban policy scenarios is refers to cumulative impact of health conditions and their associated effects for a city population. So taking into account prevalence, but also disability and mortality. And then we have current policy scenarios that we can take a look and calculate health impacts from specific policies. Like, for example, I mentioned here, Good Move plan for Brussels. They have targets over there that might be health, promoting health, like cycling and walking targets, but might not be enough. Same goes for transport master plan for Zagreb and other cities. These are just examples that I took to showcase how it could look like. And last step is scenarios for better health. So really looking at ambitious scenarios, those that are scenarios that are promoted by WHO, certain guidelines, like, for example, air quality guidelines. So coming to these levels of less pollution, improved green spaces and public spaces and so on. And in most concrete terms, we will be shortly organizing a set of workshops in Brussels, Warsaw, and Zagreb are next. So December, and then next year, Zagreb and Warsaw. These will be stakeholders consensus workshops, so with policymakers as main target audience that we want to talk to, this and covering topics related to urban and transport planning, then environment, public health policies, health impact assessment, the socioeconomic impacts. So the main aim of those workshops are to establish a dialogue and really co-create these policy scenarios with policymakers, really to see what would make sense to model in our research project for cities, that they can use it in upcoming years to either supplement their policies around healthy living in cities, or maybe create another one. So if I may pitch this event and invite some of you and your organization for participation, maybe some few points would make you more to come. This would be the opportunity to shape and co-create the focus of our research project. So you would be the one who would be kind of developing with us our research project, like Miriam already mentioned that Utrecht is doing so. There is opportunity, obviously, for networking and connecting to other relevant stakeholders from other fields in your city. And of course, you will get exclusive access to most new data that is coming from our analysis as a first organizations or person to see it. So with this, I would like to end my presentation and really invite you to get in touch with us. And thank you for your attention.
Thank you very much, Vlatka, for your presentation. We now have a couple of minutes left for discussion and further exchange and to answer any questions that came up during the presentations. And thank you all very much for sending questions. So yeah, if my speakers could please turn on your videos so that we can see you. And actually, first question, Mark, I don't know if you can answer this one briefly because we have a couple of questions. There was a question on how the ecological footprint of cities can be measured if it's different to rural areas. And yeah, is there a limit to the spatial growth of cities if you want to ensure a good health of residents?
Yeah, thanks so much. So within the project, we don't look specifically at the ecological footprint. Of course, you can do it. I mean, we look at other measures like CO2 emissions, for example, as some kind of what is the carbon footprint for the cities. Last week, we had a workshop as part of the UBDPolicy project about cities and what's happening in terms of sprawl in cities. And this was a colleague from Germany who presented some data on this. And to my surprise, most of the sprawl, what you're seeing, is actually in European cities on a world scale. We don't think about this, but we're still sprawling quite a bit. And of course, this is not good. I mean, what we want to have, in particular for an ecological and also carbon footprint, is very dense cities where people don't have to move too much. I mean, where there is not much impact on the areas around cities. So we really should address this and promote policies that work towards denser cities, not more towards more sprawled cities, what leads to more CO2 emissions, larger ecological footprint, and also, of course, more use of the car, for example.
Thank you very much. And then we had a question to you, Harry, and I think that's an important one in considering measures at city level and indeed on avoiding trade-offs between climate measures and environmental measures or zero pollution measures. So that was the question on if you're when you're assessing the climate contracts and the measures cities are taking, if you're assessing the energy changes in cities. So to be very specific, currently wood burning is very much promoted as a renewable energy source, but as we all know, wood burning increases air pollution. So is this something that you're checking to make sure there are not trade-offs there? Thanks.
Thank you. Yeah, it's a good question. Yes, we are checking about, we ask cities to make inventories of their emissions. And what we want to see is that the emissions go down. So whether you change to wood burning would not help in terms of emission levels there. So we are making scenarios there. We look with the city whether what they are proposing there makes sense in the overall reduction of emissions. So if you would replace one emission by another emission source, that would not help, and we would not support that as an idea. I would also want to come back on the previous question. We also have had a warning from our colleagues of the Committee of Regions that we should not just concentrate only on cities, but also on suburban areas and the surroundings there, and not creating what they call cathedrals in the desert in a certain way. And that's why we are working very much together also with the Committee of Regions, that what cities are proposing is not affecting negatively the surroundings there, the suburban elements.
A lot of things, factors to be considered. Thank you for this answer. I'd like to ask a question to you, Miriam. As throughout the presentations this morning, we heard that the the engagement of residents was key, the engagement of people, and that's a priority for all of that. Can you share some good practice for us on how you seen this take shape in the WTO Healthy Cities Network or in Utrecht specifically?
I think this is taking shape in different levels. So it's often when it's about redesigning streets, about developing play areas, involving kids to assess their playgrounds and just to ask them what they would like to see improved or how they would like to have a skate place in a new residential area, and what kind of a social programming is needed in order to allow all the kids to play there and to have tools to play there. So it's in a very nearby projects that are really impacting people, that have an influence on their daily life. So there we see lots and lots of examples of people really getting involved and doing the work themselves instead of us. But we see it at the policy making level as well. So to give you an example from Utrecht, our first sustainable energy policy plan has been drafted by citizens. So there was a selection of citizens and they came together for 3 Saturdays discussing, of course, facilitated by professionals and by experts, but discussing the key topics and the future on sustainable energy for the city of Utrecht. And they sort of drafted the policy plan. So that's not a policy plan we as civil servants made, but it has been written by our inhabitants.
Thank you very much. Harry, can you, from your expertise in engaging the mission cities, can you share some good practice on how this has played out in one of the mission cities?
Well, I think one thing we should see is that these 100 cities are all speaking with each other at this moment because they all have similar challenges, no? And what is happening is that for the mission platform, we have a portal with more than 100 solutions, best practices in all kinds of areas where cities can use and can discuss about replicability, whether it would be also for them helpful there. So what we see now is that cities are more speaking amongst each other. What are the common challenges and how could they approach this? And I think this is an idea about scaling up replicability and using best practices and not trying to reinvent the wheel each time when a problem is there. And this should be the power of this city's mission to bring actually a critical mass there, which also other cities who are not part of the mission can use afterwards as best practices experiences for getting to climate neutrality.
Thank you very much. Indeed, I'm almost amazed at the wealth of good practice that is available, and looking for ways on how to share that more. We've come to the end of our webinar, unfortunately. So, Mark, I would like to give you the opportunity for the last word in responding very much to the engagement or to question which we had as well in terms of how the UBD work will be scaled up for other cities.
Yeah, thanks so much, and I hope that the viewers here have got a good idea about the UBD policy, and that also we're producing health estimates and that we're monitoring kind of the burden related to a number of different exposures. We do this on a large scale for the 1,000 cities and a bit more detail with the case city studies. But what we're looking for is particularly also working with others. I mean, other stakeholders. I mean, we very much come from a health perspective and we can't change that much. We also would like to engage with urban planners, transport planners, education sector, actually to make the changes. I think what is very important to have this engagement with everyone. There are a number of city organizations around at the moment. I think they're doing great work. I mean, like the Polish Network, What you have is Eurocities, you see 40 ICLEI, the Clean Cities campaign, the Healthy Cities campaign, as what we heard, also the mission. And I think we need to work together. And also, you know, what we really need to have is also a vision for a healthy, sustainable, and livable city. And I think that's sometimes missing. I mean, it was nice to see what Utrecht has for the pyramid, but also we need to put this vision together for 2030, 2040, 2050, what our city should be look like. And I think we need to work towards that, of course, with all these organizations, but also with the citizens, because that's where they live.
Thanks very much for these encouraging words and the message for World Cities Day. And indeed, with that, we have come to the end of our webinar. And I would like to thank you very much. First of all, thank you to our speakers and presenters here this morning for your excellent contributions and food for thoughts, and really highlighting the many opportunities for linkages and synergies that we have in order to really protect and strengthen the health of people living in cities. I'd like to thank also very much our translators. Without you, we couldn't do this kind of work, so much appreciated. I would like to thank the HEAL team who has contributed in organizing this webinar and running through it, and also thank you for the recordings. The recording of this webinar will be available soon, so please check it out on the HEAL or UBD websites and channels. You'll have the recording in English, in Polish, and in German, and please share it in your networks. And I would like to, last but not least, thank you all participants for being here this morning and really showing your interest. And I very much look forward to continuing this conversation, as it's very clear that on this World Cities Days, that day that we all need to step up and we want to do more together with city decision makers on protecting people's health from the environmental and climate threats that we're all faced with. Thank you very much and have a good day.